Welcome, everyone, to episode 34 of APS Radio. My name is Jim Bernica, and today I am joined by Jon Vought from Rescue One CBD. Good morning to you.
Good morning. Thanks for having me, Jim.
Yeah, so last week, I got to hang out with you at the exotic Beaver Creek, Ohio Firefighter Health and Wellness Conference. You were a speaker there. You had a table there, and we just were able to spend some quality time together. And I wanted to continue that and also just be able to share kind of what you're bringing to the fire service.
Yeah, thanks, man. I'm actually surprised we got to spend even a couple of minutes each day. You look like you were running around like a madman. So great conference. You and Nick did an awesome job. It was just, it was impressive, and I'm looking forward to next year too, man.
Yeah, we're working on that stuff right now. And it's right. You know, we didn't get to spend a lot of time. It's almost like having a wedding. Like I
Right.
remember my wedding, and just like, I know there were people there. I know I talked to them, but I don't remember hardly anything because there's too much stuff going on.
Yeah, you guys lined up pretty impressive guests. The speakers there were, top notch. And I guess I'm at the risk of sounding arrogant because I was a speaker, so I don't want to put me in that category. But like, James Gearin had that live podcast that was just incredible. And then the guys who were there for the Burned documentary, just all of it, man. Brendan McDonough, all that stuff. That was wild. I was impressed.
Yeah. So now I gotta try to figure out how to top it.
One up it.
And that is problematic. I feel like I called in about all my favors I could this year, so we'll see.
Hey man, you did it for 6 years. Like, this is your sixth one, right?
Yeah, that was my sixth one, but I don't see anything up my sleeves right now.
Something will work out.
Figure out something. But
Yep.
Tell me about how did you get involved, with CBD? I know you've obviously been a firefighter, but how did you kind of this whole thing come together where you realized that this could be something for the fire service?
It was a combination of me being post-surgery, looking for something to help my sleep after I had to come off of opiates for a long time, which was hard to do, and being super frustrated that I think the general way we approach medicine in the fire service, the way we're kind of forced to do it is upside down. And those two things combined, I just I put it out there. I started taking CBD myself after my sleep was really screwed up. And opiates, that's the one thing that they don't tell you about that I learned the hard way, was that it wrecks your sleep cycle after you stop taking it. And so it was weird that for the first time in my career, I was spending time at home and sleeping in my own bed every single night because I was laid up from surgery. But my sleep was worse than when I was on shift. And I was like, what the hell? And if you're in that situation, you go and you ask your doctor, hey, how do I fix my sleep? They're going to say, which one of these 3 medications do you want? And, if you tell them like, hey, I don't really want to take more medication because that's what screwed me up in the first place. Like, can't I just do something else? Like, is there, a way to reset this thing? You don't really get much direction. So started taking CBD, found out what it did for my sleep. I started in the industry, like working for another CBD company, and kind of got the ins and outs of how to make it. And I saw you can make it safe for the job. It took me a long time to learn how to do that. And working with this lab out in Colorado, and here we are. So been in business for 3 years, and thousands of firefighters have used our product, 0 failed drug tests. So we're really proud of that.
Perfect. Let's actually back up. I should have probably asked even in the beginning, what exactly is CBD?
It's a good question. A lot of people, I think there's some misunderstanding about it, and the fire service right now is kind of like at a range. Like, there's people who've never heard of it at all, and there's people who are extremely educated on it. So I'll just kind of give you the middle there. But CBD is in the compound of cannabinoids. THC, the thing that makes you high in marijuana, is also a cannabinoid, but CBD doesn't make you high. It is an anti-inflammatory, and it helps your sleep cycles. Those are the 2 main things that research has shown that would help in firefighters. There's other stuff it does too, like balance your serotonin, so it makes you feel calm and kind of relaxed. But it's it stands for cannabidiol. It's one of over 100 compounds found in the cannabis plant. It's mostly found in hemp, not in marijuana. And so when you're extracting it, they go for the hemp plant. And hemp is kind of a catch-all term for a cannabis plant that has very, very, very low amounts of THC to start with. So we always go for those plants, obviously, because the whole thing with us is, passing a drug test. So cannabidiol, just a molecule. It's not a miracle. It's just a molecule that we extract from a hemp plant, and it has some awesome properties like benefiting your REM sleep and reducing inflammation. That's the gist of it.
Perfect. What is, I know you said you obviously you test your stuff, and it's, nobody's failed a drug test. I know that has to weigh heavy on the fire service. The last thing they want is you to take something and end up failing a drug test that they thought was safe. So, you see, I mean, he can go in whatever gas station and get, the CBD stuff. What is the difference between what you do and what you'll see at your local, whatever gas station you go to?
This definitely keeps me up at night. I'm worried that firefighters around the country will see or hear people talking about CBD and say, yeah, it's CBD doesn't cause a failed drug test. And they'll go, cool. And they'll go into, any gas station, and right next to whatever weird ass supplement is on the shelf, they grab a CBD, tincture and think that it's fine. The difference between us and them is, one, we make our product, with the lowest detectable. We use instruments that detect down to the lowest possible level that has ever been invented. So the machine we use, for anybody that really wants to geek out, is called an LC triple quad. It is liquid chromatography for my hazmat guys, and we can identify parts per billion of THC. So it's an infinitesimally small number, and we go down to 0.000% THC in the raw ingredient before we even start to make the product. So we test down that ingredient at that level. That's the first thing nobody else does. It's extremely hard to remediate all the THC down to that level in the ingredient. So that's the first part that's like extremely, extremely hard, very time consuming and expensive to do, that nobody else wants to do. The other thing we do is we test it 4 times throughout the process, so that by the time we make the final bottle, you've gotten a test during manufacturing, after manufacturing. We do a third-party test, and then once we bottle it, we test it again, so that you have consistency throughout. And then the final thing is, a lot of the bottles that you buy, even of reputable brands, are sometimes they don't have the amount of CBD that's claimed on the label. So it could say 1,000 milligrams, but you're really getting like 500 or 700. So when we test the final bottle, when we test the final product, after we bottle everything, we're ensuring that I didn't screw up the fireman math and that you're actually getting 1,000 milligrams in there. So both with consistency of the amount in there, and then making sure it's a pure product and has 0 THC. That's the ultimate difference between that, and like overseeing that and making sure we do it every time. Because the truth is, like, I love Charlotte's Web as a brand. They're the biggest CBD brand. I think they're really good. But when you see the label Charlotte's Web, they're not sticking their neck out for the fire service to ensure that we have that 0, THC claim. I intentionally chose to aim this product at firefighters because I'm on the job myself. And when I put the Maltese cross on that label, I'm saying something. I'm saying, I'm putting the fire service first, and I'm trying to show the guys and girls out there that this is specifically for them, and I'm not going to screw them over. I'm not going to cut corners. I want to make sure that it's absolutely safe for the job, and that you'll never have to worry about passing a drug test or failing a drug test if you take our product. So besides all that technical stuff I said, like putting that Maltese cross in there means something to me. So I didn't just do it willy-nilly like for a marketing stunt.
Yeah, no, it makes sense. And even in your packaging, I loved it. You actually have a drug test in the packaging.
Yep. Yeah, that I can't take credit for that one. My buddy Joe, gave me that idea. And he's like, because I kept telling him, like, he worked on my crew for a little while. I kept telling him, like, man, I don't know how to like reinforce to these guys out there that you're gonna pass a drug test. He's like, just give them one. Give them one at home. And I was like, that is a good idea. So I buy them in bulk. I buy like everybody gets a little THC drug test kit. You got to see for yourself. You know what I mean? Like ultimately, at the end of the day, I could tell you everything, but if you're not seeing it with your own eyes, we're skeptical by nature in the fire service, which is good. Like I said, I don't want people going to the gas station and buying some random stuff.
To touch on that, the fire service and just being skeptical and trying to get out there and educate them. I mean, this episode I hope is one way of getting out there and educating them, but I have to imagine there's so many people that they probably see this stuff and they think it's the devil.
That's exactly it. It's so hard, man. Like, but it's getting easier. I go to FDIC every year, and the first year was tough. The second year was a little bit easier. The following year was
when you say you go to FDIC, are you going there as a vendor or just okay?
Yeah, as a vendor. Yeah, I set up every year, and it's like a knife fight out there because there's so many vendors. But it's so crazy,
the biggest firefighter circus in the world.
Oh yeah, and it's a great experience every year, but it is a ton of work. So I started noticing that the age demographic, you'd be surprised by that changed. Typically, with things like this, the older generation is more resistant. But now what's pretty crazy is the older generation is actually my biggest customer demographic, because these are the guys and girls out there that have been on the job long enough to have the inflammation, the chronic back problems, the sleep issues, the stress and trauma from the job. And now they're at the point where they're like, okay, I'm tired of feeling like this. I don't want to take, I had guys telling me they would take like 1,000 to 1,600 milligrams of Advil every single day, and their doctor wants them to do that. I'm like, for how long? So it's like starting to get a little bit better, but I'll tell you, two of the things that bother me is, one, that they think it's like the devil's lettuce, still. And it's like, what the hell are we doing here? But two, when I start to talk about how I want to improve how the job disrupts our sleep cycle, for example, and say like, hey, physiologically, we're not meant to be up several times after midnight. That's not normal for the human body. And I want to try to do something when you're off shift to help you with that. Everyone's like, well, bro, if you can't hack it, like quit, like don't, that's exactly what they go to. And that's frustrating for me, because I'm trying to say, hey, this isn't, treat it as a new technology. Okay. When we got the SCBA and everyone said, hey, you don't got breathe in smoke anymore, did you want to be the guy going, cool, let me wear it? Or do you want to be the guy going, if you can't hack it, quit? I mean, it's just, that's the other frustrating side of it, is people are resistant to it because the machismo side of it, where they go, I don't need anything to help my sleep. I'll sleep when I'm dead. That kind of shit. And that bothers me too, because I'm thinking to myself, I like working busy trucks. I want to stay on the job a long time. So why wouldn't I take something or do something for my health to help me stay on those trucks? You know what I mean? To help me like be better at the job, to have a longer career and a healthier career, and have a healthy life after you retire. Like, well, why would you not want that? You know what I'm saying? So it's self-defeating when they think like that, but educating is the biggest thing, man. And just getting people, to understand what I'm trying to do and what CBD kind of is the goal. That's 100% the goal.
Do you find yourself kind of tagging onto a lot of the medical marijuana talk? Even though it's different, it's still kind of viewed a lot of ways in the same way. And there seems to be a lot of traction, depending on the state, and even the departments throughout the states. They're all going to be a little bit different, but we've seen it before. We had Sean with us last week. Pittsburgh actually putting medical marijuana in their contract, which was to me unbelievable to do that. Working on my own contract and seeing how that would probably never happen there. But I mean, do you see yourself kind of attaching onto that and just going for the ride as well?
Definitely. I was really resistant to that at first. And, because not because I wasn't a proponent of it. I'm a huge proponent of THC when it's indicated. That's the big point, when it's indicated. But I wanted to make my brand very separate from it because I don't want people to think that like I was putting THC in my stuff. So, I think we've gone past that, and nobody's worried I'm putting THC in products. But the the truth is that they're two different compounds that do two very different things. You'll always need both of them together. So even when, because honestly, man, I think sometime in my career, I don't know when, but sometime in my career, sooner rather than later, we'll all be able to use THC products because we'll have solved all the problems that come with drug testing and intoxication levels and whatever else. So at some point, yeah, we're going to be kind of having both of the compounds at the same time. And THC doesn't help your sleep, CBD does. So when we talk together, we like to talk about both of those things, but they really are kind of in the same boat, because not just because they come from the same plant, but because they are viewed almost like very, what's the word I'm looking for? I guess there's a lot of controversy behind them, right? They're viewed with a lot of controversy. They're kind of from that generation, like the DARE generation, where it's like it's a gateway drug and all of that nonsense. And so there's a lot of stigma that has to be broken to get past it, but also to like educate. So and honestly, the alternative from that to pain medicine is very clear. It's proven that there is no risk of overdose from marijuana. There's no risk of addiction when it's compared to things like opiates, and the benefits of sleep, or helping you put to sleep, are better than some of these other ones. So it's like it's just one of those things where I hope as we talk about it more, it gets more accepted, instead of like when I started. I'm sure when you started, if we were to talk about this stuff at the firehouse table, it would almost be like a whisper, like you wouldn't want to talk openly about it. Now the fire chief sits at the table and we talk openly about it, based on what other people are doing and things like that. Cause it's not like it's this big illegal thing across the country anymore, So
Yeah, I imagine there has to be an absolute ton of research that just talk about the benefits.
yeah. With CBD in particular, there is, specifically because a lot of people don't know this, but CBD there is a FDA regulated medication that's just CBD and strawberry flavoring. So it's for pediatric seizures. It's really effective for these two types of seizure disorders that kids have that are very deadly. And one of them is called Dravet syndrome, and the other one's called Lennox-Gastaut syndrome. But they realized that CBD was reducing seizures, so Big Pharma came in and made a drug that is literally just CBD and strawberry flavoring. It goes in like a little gel. It's very, very, very high dose, extremely high dose. And they give it to kids. They put it in their gums. It's like just like how I have a CBD oil tincture. They have like this oil, and it just goes right between your cheek and your gum. Well, to do that, to get that medication, you got to go through 3 phases of FDA trials. That takes years and millions of dollars and tons of research, because they have to prove, one, that they know how it works in your body, how it moves around, its safety profile, what doses look like, all this extra stuff. Then they have to test it on humans, make sure it's safe. Then they have to prove that it works. So those 3 different phases were all done with reports and published medical studies that had to be peer reviewed. So that was kind of the foundation for understanding how the dosing worked, how you're supposed to take it, its efficacy level, like therapeutic level, all this crazy scientific stuff. And then after that, they started going, okay, well, what else does it do? What does it do for your anxiety? What does it do for your mood or anything else for sleep? And so all these other universities started branching off and doing this. It really started peaking in like the last 5 years, because before 2018, hemp was still considered marijuana. They were both considered the same plant. So it was illegal to study it unless you had like DEA approval. So that's why it's kind of blown up, was because in 2018, they're like, can we stop calling this plant that we make plastic and rope out of weed? It's not marijuana. You could smoke a pound of hemp and you wouldn't get high. That'd be pretty gross, but you wouldn't get high, So, you're, yeah,
Oh, you're making me think. I can't remember. It was one of your guys' slides, and it was something like 1,500 pounds is what you would have to
yeah,
ingest, and I remember
Sean.
looking at that, and I think I had Nick sitting next to me, and I looked at him. I just said, "That seems like a challenge."
Well, that's funny that you said that, because like immediately after, Sean goes, I know some people in here might try, and that's funny to hear that you were actually saying it, because you were the guy he was talking about, apparently. You're like, challenge accepted. Well,
Yeah,
yeah, so it's just, it would take so much. But um I guess the point is, the research that happened after was so groundbreaking, because of the foundation that was set. And I could go into like all the different stuff, but really the biggest things that they found were that it reduces inflammation in the same way that a steroid does, like prednisone. It improves overall REM sleep, and by a few different ways that are kind of scientific. And then it improves your mood. So people that usually have constant stress are, you know, uh, in a state of chronic inflammation. You know what I mean? And um, also, you come home and you're still like wired up, right? Like, you ever had that? You come home and like you're still hyper vigilant. You can't like shut it off. You're like, man, I'm exhausted, but I can't like lay down and go to sleep right now. So
yeah,
that's kind of those are the big three that I always try to go for. I mean, there's all kinds of stuff they're trying to look at it for, all the way from cancer to improving liver health, and stuff like that. But there's really the bulk of it is those three things: inflammation, sleep, and your mood.
perfect. Yeah, I even love like your names, like your sleep is out of service. That just that actually
Yeah.
made me giggle when I saw that.
Yeah. One of our customers, who ended up becoming like one of our brand affiliates or brand ambassadors, Ryan Carlisle. She was a Olympic. She's on the U.S. Women's team, the Olympic rugby team, and she's a gold medalist. Like, she's a badass. She came up with that name because I was like trying to tell her, like, oh, we gotta. She said, hey, can you make a higher dose? And I was like, yeah, that'd be kind of cool. I was like, we should put terpenes in it, make you feel tired. She goes, oh yeah, the out of service version. And I was like, man, I'm stealing that. So I told her straight up, I was like, I am 100% stealing this. I'm sorry, we're a startup. You can't get any royalties over it, but I'll mention your name around, she's laughing. But yeah, the at a service version, because that's how we want it. That's how we want it to feel like, all right, I'm done, right? I'm home.
Yep,
I'm out of service. I'm going down. Like, I'll take a dropper or two and I'm passing out.
yep. It's been nice. I've used it ever since last week. It's been
Nice.
nice.
Cool. Good.
And
Yeah.
even, I know I'm looking at a shoulder surgery probably coming up, and
Mm.
and just like kind of what you were talking about earlier, I know what they're going to prescribe me, and I know I don't want to really take those.
Yeah.
So
Yeah.
um it's actually being it, knowing that I have alternatives to that, which didn't really exist, at least legally, a couple of years ago.
Right.
This is a good thing.
Yeah. I don't know. So opiates obviously have their place. There's my foot surgery. I had a fusion done on my ankle. They had to put 3 screws in there and, basically break a couple of joints. It's ugly and extremely painful. So like, at some point, it's not going to cut it. Like, to be clear, CBD is not a pain reliever, right? It's an anti-inflammatory, like you and I had spoken before. But THC is a pain reliever. It kills pain. It goes at the nerve site and it stops the perception of pain. So it works directly on pain reception, and CBD just reduces inflammation. So they're good together, but THC is the king of pain relief for sure. So that could be an alternative for you, and when people say like they they want to use CBD instead of painkillers. I'm like, that's not what it's intended for. Every medication has its place and time. I believe in that.
Yeah.
I'm not like an anti-medicine. I just prescription medicine. I'm just like, hey, when it comes time to stop taking it, it's gonna suck. Like let's work on some other stuff. That's where I think CBD comes in, is when maybe you stop taking these things and your sleep's all screwed up. But yeah, I'm a big proponent of taking painkillers when you need it. I
think
mean, sometimes you just gotta have it.
even getting me to that point,
Mhm.
using your, roll-on applicator the last few days has been
Yeah.
just helped, I guess, take the edge off a little bit
Yeah. Yeah. What kind
more
of
than anything.
shoulder surgery you got to do?
It's going to be just a scope,
Okay.
nothing too
That's good.
crazy. I mean, he said, yeah, the doc said I'll be able to drive and do a lot of things the very next day. I just
Good.
not anything where I have to go, have my arm up. That's where the problem's going to be. But it's like a 6-week recovery compared to like 6 months if I had an actual tear or anything.
Yeah. One of my guys is going through that right now. And
So
yeah.
the
Ugly.
worst thing is, like I won't say that I looked forward to being injured when I was working, because not like I got injured on purpose or anything, but like I knew at least when I got injured or I had surgery that I was going to be off work. I was going to be able to grow a beard or something. And now I already have a beard and I don't work. So there's like no benefits for actual having surgery.
You're like, this just takes me out of commission for shit I want to do.
Yeah.
Yeah. I know we are trying to get a study started with Johns Hopkins, where we're gonna take firefighters that are injured, give them THC instead of opiates when they're recovering, and see if they can have similar pain tolerance and similar return to work time. To kind of get the ball rolling towards that. That's one of our goals. We talked to the guys at the Cannabis Science Lab at Johns Hopkins. They said they're all about it. We're trying to do more stuff like that. We're working with the IFF to get some funding to do this stuff. They haven't agreed to it yet, but that's what I want to do. Is the Cannabis Science Lab agreed to it, but the IFF has not yet. But do stuff like that where we can show where this stuff is valuable.
Yeah, no, that's great. And that'll help future generations of firefighters.
Yeah,
Just giving them
definitely.
that option. And if you're able to have that research, and that's, that opens up a lot of doors. So,
right. Cause I mean, you worked on contracts, right? Like, so a lot of this stuff, like, when you ask for it, they go, okay, well, who else is doing it? Give me a comparable contract. Where did this come from? Show me some number. When it's finance, they're like, show me an actuarial study. When it's policy, they're like, where else is doing this policy, or are we going to be the first? If somebody's going to be the first, luckily nobody has to be the first. Pittsburgh took that bullet for us. So 6 years ago they did that, but after that it's data, right? Like, okay, well, they've been doing it for 6 years. How does it look? What happened? Which they have some amazing data. All the stuff you want to go down went down, like EAP usage, sick time usage, off-duty arrests, like
DUIs and
crazy. DUIs went down.
Yep.
Because guys are like, I'm not going to drink anymore. Which is awesome. Alcohol is, it's a freaking toxin. It's like a known toxin. So, there's a lethal dose of alcohol. There's no lethal dose of THC that you can actually ingest. Like Sean said, you'd have to smoke. Can't remember
again. It sounds like a challenge.
in a 24-hour period, though. It has to be quick, because if you smoked 1,500 pounds in a year, which you probably have, some kind of lung cancer if you did that, but you wouldn't overdose. So 1,500 pounds, that's more than 100 pounds a month. I don't know, man. That's got to be, I'm going to do some math on that. And, we'll get back to like how much a day that would end up being like. That's I'm not saying it can't be done. I'm just saying it's a little tough.
No. How do people find you? Like, where do they track you down in a non-stalker way? But like, if they want more information, well, man, I mean, if you're into that stuff, I mean, I don't know.
Yeah, people be into anything. The easiest way is Instagram. It's rescue _1 CBD. But if you start typing in rescue 1, it'll just pop up. That's the easiest way. I myself and my sister Kim monitor the Instagram. So, if you message me, whoever it's for, I'll be able to see it. If it's just a general question, Kim can answer. But if you're trying to reach out to me, that's pretty quick because I always have my phone on me, and I just happen to be on Instagram like all the time. But also, if you just want to reach out, it's Jon, Jon, at rescue1cbd.com. But our website too, rescue1cbd with the number one. Yeah, that's where we have everything. And there's a lot of good information on there too. It's not just buying products. It's there's a lot of info. I've written quite a bit about, like, a little bit deeper dive into, some of the science behind it. If like anything I brought up just, made more questions for whoever's listening, like, you can go there and check out a lot more, deeper topics. So it can get a little bit more technical and scientific and whatever else. And I also like talking about this stuff. So if you have any questions directly for me, I'd love to answer them.
Perfect. I love how you're into the Instagram. Old people like me miss MySpace.
Dude, I grew up on MySpace, man. Like, it's definitely that holds a very nostalgic place. But Instagram is so quick, man. It's like, I find people reach out to the brand way more on there than they do on email, because they know, like, it's on somebody's phone. It's like sending a text message, so that is pretty cool because I get to interact with people a lot, and I enjoy it.
Oh, very cool. No, I mean, it's good. I mean, you have to kind of interact because, I mean, it's kind of up to you. You're like one of the lead guys to educate people on this.
Yeah, I gotta think about that sometimes. I didn't try to make that my goal here. But I started looking around and I'm like, there's nobody else doing this. Steph White is kind of trailblazing with all the writings that she's done with fire engineering. And Sean O'Leary obviously is on the circuit, like, constantly going around presenting. So, those two have been doing it longer, and they are absolutely good sources of information. So I'm just trying to, like, do it too, whatever I can do. But I like talking about it. I really do. So when people ask general, like, honest questions, there's nothing I don't like talking about. So I just try to put that out there.
Perfect. Well, do you have anything else you want to add?
No,
If not,
I just want to say thanks for having me. There is an important part of getting the word out. It's everything, actually. So whenever I have an opportunity to do stuff like this, it means a lot. So thank you.
no, and I thought it was just cool. Nothing else, to continue what we started, last week. We were able to talk a little bit. We were on, was it your show? Whose show was it?
TJ put it up, TJ Leather. So that was Keep the Promise podcast. He's got way more listeners than I do. He's got a good amount.
Probably me too. I don't know. I don't even know anymore.
I don't even look. I'm like, yeah, it's just fun to do, man. And I love doing stuff like this. This is awesome.
Yeah. And it's, the nice thing is, I feel like I'm building, and I actually had this discussion with James Gearing, like, building libraries. Like, at any point in time, anybody can go back and look at whatever subject and get information.
Right.
So that's all this is just building a library. So this is the, CBD location,
Yeah. Yeah, that is cool. It becomes helpful for people too, especially, I think a lot of people do that. I do that. I find a show I like. I'll scroll back years, and I was like, oh, look at this title. That looks pretty cool.
Yep.
People consume a lot of content, man, and everybody listens to podcasts different times. It could be running or in the car. So no, it's good. It's awesome.
Absolutely. So with that, how about I get you out of here and I'll go. The boys are out of school today, so we'll go have lunch and get in trouble somewhere. I don't know.
There you go, man. Enjoy that fall weather. I wish I was back in Ohio right now. It's back up to like 80 something degrees here. So
yeah, but then it's been like in the 30s and 40s since you left. Last week was a unique week. Yes, it escalated quickly here, which it does. I mean, it's typical to have all 4 seasons in a week here.
Yeah. Yeah, I bet. I saw all the good stuff.
You did. You
There
were
was not a
spoiled.
cloud in the sky. There was like, yeah, it was really, really nice. I was just enjoying driving around. It was cool.
Yes, indeed. So I'll get you out of here. I'll get out of here myself. He's John, and I'm Jim. Check him out, Rescue One CBD. Check out the website. Um, try some of it. I mean, I've tried it, and I'm a believer. So with that, let's get out of here. John, Jim, take care until next month.
Thanks, brother.